Hi, I'm Dr. Navdeep. Today I'd like to talk about endometriosis. Recently I had a patient who had come to see me in the clinic with severe abdominal pain. On assessment, using an ultrasound scan, I noticed that she had two big ovarian cysts, which was most likely an endometriotic cyst. This is quite a common disorder affecting a lot of women in reproductive age group. The symptoms can be from nothing at all. They may have cysts but they don't feel anything, to severe abdominal pain, especially during their menses, known as dysmenorrhea. They also can have pain during the sexual intercourse. And some may even have irregular menstrual cycles. A lot of patients ask me about the cause. Why do they have it? And it's pretty much debated recently. It may be due to immunological problem, genetic issue, even something called a retrograde menstruation, where the menstrual period go through the fallopian tubes and implant on the ovaries. These ovarian cysts, they contain brown color type of content, which is basically old stale blood, and it's similar with the menstrual blood. The lining covering the ovarian cyst is similar with the lining of the womb, where every month you get your menstrual period, the lining gets shed out, and a similar thing occurs in the ovarian cyst. So that's why it gradually increases in size and becomes more and more painful as time goes on. Important thing here is that it's non-cancerous, okay? But if the symptom is severe, it needs treatment. How do we assess the patients? Firstly, by doing a general assessment, abdominal palpation to look for any swellings or mass, and then imaging methods, for example, the ultrasound scan. That's the easiest method for us, where we can determine the number of cysts that you have and determine the size and site of it, because an endometriotic cyst can be on one ovary or both. It can be a single cyst or it can be multiple cysts in the same ovary. As for treatment options, it all depends on the age of the woman and what does she want. Does she want pain relief? Does she want to conceive? Okay, then the treatment options tend to vary accordingly. We even give tablets, for example, the birth control pills, that can help regulate their cycles and relieve their symptoms markedly. There are certain type of tablets that we have, for example, Vicin, which can help to reduce the progression of the disease. But these methods do not cure the endometriotic cyst completely. The other method would be surgical excision of the endometriotic cyst. This is basically done under anesthesia, where we do a method called laparoscopic surgery, also called as a keyhole surgery, where we insert instruments into the tummy and then we try our best to excise the endometriotic cyst wall. By doing this, the recovery, the patient is much better, their symptoms will resolve. And to reduce the recurrence rates, we give them medication in terms of tablets or even injections to stop their menses or stop their menstrual cycle for a short duration of time. In spite of that, many women still come back with recurrence, and the rates are more than 30%. The recurrence can occur within 6 months, even a few years later. So it's important that even after treatment, we need to see a doctor to look for any new cysts which are forming. Now coming to infertility and endometriosis. Surgical options may be used if the cyst is huge. But if you have mild endometriosis or small endometriotic cysts, you do not need surgery for that. You can try medication, for example, clomate tablets, even letrozole, to grow eggs and have intercourse in the best time. Or you can do intrauterine insemination, where we can inject the sperms into the womb. But the main prerequisite here are, number one, at least more than average sperms to open fallopian tubes. If the cysts are huge and there's a lot of symptoms, then you have no choice but do surgery first to excise as much as you can. We'll try our best to conserve as much normal ovarian tissue as possible, because any form of surgery can damage the ovaries. In women who have done many surgeries for endometriotic cysts, they'll have a lower ovarian reserve, because there can be a lot of collateral damage, especially if we use things like diatomy to remove the endometriotic cyst. The other issue would be if your fallopian tubes are blocked, then IVF is the only option for you, where we give you injections to get your eggs to grow, and we retrieve the eggs, mix it with your husband's sperms in the lab, and then transfer it back into your womb. The bottom line is this: patients with endometriotic cysts can still have their own child, can conceive even naturally if they want to, okay? But most importantly, you need to see a doctor to assess the severity and find the best treatment option for yourself. So you need to know more about this. You can drop me a message. I'll be happy to reply you. Thank you.